So I get questions on when am I a candidate for a shoulder replacement. A shoulder replacement is indicated for someone that has severe bone-on-bone arthritis of the shoulder. We typically have tried some physical therapy, we've tried some steroid injections, anti-inflammatories, and those just aren't working anymore. Our shoulder's becoming more painful, we're losing motion, and then we have a diagnosis of arthritis, and that diagnosis is done with physical exam in the office, x-rays, and then sometimes a CT or an MRI. A shoulder replacement typically involves an overnight stay in the hospital, one night, and we get you home the next day in the afternoon. The shoulder replacement is where we go in and resurface the socket. We put this plastic piece on there, and that takes the place of all the damaged cartilage. The same thing happens with the ball. It gets resurfaced with this metal piece, and this becomes your new shoulder joint. Recovery is typically 5 to 6 months to get over the surgery, and that involves a great deal of physical therapy, taking you through 3 different phases of physical therapy over a 5 to 6 month period.
Call the Shoulder and Orthopedic Institute today at 405-330-8847.